According to a recent heart health survey by the Cleveland Clinic, men are less likely than women to change their diet due to personal experience with heart disease. Why do you think this is?
Oh, I think women are more body conscious than men. They maybe pay more attention to their personal appearance. And look, whatever their reasons may be, that's fine. If you want to look better, that's great. But the most important reason for changing your diet is to be more heart healthy.
Great. The survey also uncovered what are the biggest negative influences on people's diet choice. Not too surprising, fast food and vending machines. What are some other culprits that keep us from eating healthy?
Well, we live in a very rapid-paced fast food culture. Our grandparents did a lot of cooking. They had prepared foods. They ate a lot more unprocessed foods. But now in a modern American society, both the man and the woman often work. It's a lot easier just to stop and at the grocery store and get a frozen dinner or eat out of a can or go to a fast food restaurant or eat out of a vending machine. And what we need to do is to go back to the older ways of eating these well-prepared meals that are healthy and that don't have all the processed foods that we now eat.
How does eating a healthier lifestyle help prevent heart disease?
Well, we have lots of information. First of all, Americans are very confused about diet. They've been bombarded with information on every fad diet you can imagine. Low fat, low carb. There are zillions of diet books out there, and almost none of them are based on good science. There is good science around one diet known as the Mediterranean diet. The Mediterranean diet is a diet eaten by people who live around the Mediterranean Ocean. It's very high in fruits and vegetables, has some pasta, has a lot more fish, and it has lots of olive oil and nuts. Those are very good and very healthy fats. And in a large study performed in Spain, people that ate the Mediterranean diet had a 30% lower risk of developing heart disease than those that ate the more traditional low-fat diet that many people believe to be heart healthy, but actually isn't.
So let's talk a little bit about exercise. How much and what type would you recommend for heart health?
Well, it doesn't matter so much what type of exercise you do as long as that you do it. You can walk, you can run, you can cycle, you can swim. We want people to get at least 20 minutes of exercise, vigorous exercise, 20 minutes 3 times a week. And better yet, if you can do it every day, that's better. And if you can go for 30 or 40 minutes, you're in the zone of really a heart healthy exercise program. It will help you to shed pounds. It helps us to avoid obesity, and it has a tremendous benefit on keeping the heart healthy and helping us to live longer.
Why is blood pressure and cholesterol as important as to monitor as weight and weight size?
Well, first of all, we talk about risk factors for heart disease, and blood pressure and cholesterol are 2 of the key risk factors. If your blood pressure is more than 120/80, you're at increased risk. And if you have an elevated level of your bad cholesterol, your LDL cholesterol, that also puts you at increased risk. In both of those cases, we can do things with lifestyle, but we also have very good medications. Eating less salt in the diet can help to lower blood pressure, but in addition, we have very good blood pressure lowering medicines that are widely available. Similarly, one can lower cholesterol a little bit with diet, but you can lower it a lot if you need medications with the modern medications that are available. If you control those risk factors, you can reduce your risk of developing coronary heart disease.
Well, great. Is there anything that I'm not asking that you think that my readers should know?
I think the main thing is that people have to realize that if you're eating, fast food, spending your evenings sitting on a couch, you are at risk. And if your body weight is up, and particularly if you have an increased waist circumference, then those are risk factors for heart disease. It's never too late to change, and so it's never too early. We ought to do this with our kids, and it's never too late. And just make those changes, and you'll be a lot better off for it.
Excellent. Is there a website or anywhere that my readers can go for more information?
There is. We've set up a website with all this information. It's cle.clinic/loveyourheart. Lots of information on the website.
Excellent. Well, thank you so much for taking the time to talk to me today.
My pleasure.